It's pretty amazing to think about how one single molecule can live such a double life. It's a substance you can find in sterile operating rooms, but also at all-night raves. For some people, it's a lifesaver. For others, it can cause serious harm. Today, we're digging into the world of ketamine.
And this is really the central question, isn't it? I mean, how can one chemical compound wear so many completely different hats? It's a battlefield anesthetic, a revolutionary antidepressant, and a notorious club drug. If we can understand this paradox, we can really start to understand ketamine itself.
So to get to the bottom of this, we've got to start by looking at its fundamental nature, this duality. It's a molecule that's really defined by the tension between healing and harm. Okay, so what is it officially? Well, at its core, ketamine is what's called a dissociative anesthetic. And that word dissociative is absolutely key. It means it creates a sense of detachment, a feeling of being separated from your body and your surroundings. But here's the kicker, it does all this while your heart and lungs keep ticking along normally, which is exactly why it's so incredibly valuable in medicine.
But it didn't just appear out of nowhere with this crazy resume. Its journey over the last 60-odd years, from a staple in war zones to a psychiatric wonder drug, well, it's a truly remarkable story.
Let's just walk through this timeline because it's wild. It all starts back in 1962 when it was created to be a safer version of PCP. Fast forward to 1970, it gets approved for medical use and pretty quickly becomes a go-to anesthetic on the battlefields of the Vietnam War. But at the same time, its unique effects meant it didn't take long for it to find its way into club culture as Special K. Then, in the 2000s, the whole game changes again when scientists discover its incredibly rapid antidepressant effects. That discovery just turned the world of psychiatry on its head.
So what is actually happening inside our heads to cause all these powerful and varied effects? How does it pull us off? Let's dive into the neuroscience and see how this molecule can literally rewire the brain.
You can kind of think of it as a four-step chain reaction. First up, ketamine goes in and blocks the brain's usual communication channels by gumming up something called an NMDA receptor. So what does the brain do? Well, it panics a little and responds by releasing a massive surge of its main chemical messenger, glutamate. This glutamate flood then activates a different set of receptors, called AMPA receptors, and that is the final domino, triggering the release of a crucial protein called BDNF.
And this quote just nails it. That protein, BDNF, is basically like miracle grow for your brain. See, in conditions like severe depression, the connections between your brain cells can actually shrink and wither away. This sudden release of BDNF helps spark the rapid regrowth of these connections. This is the leading theory for why it works so well as an antidepressant. It's not just tweaking brain chemistry, it's helping to physically rebuild the brain's architecture. Okay, so with that science in our back pocket, let's really focus on the first side of this coin, ketamine's incredible power as a legitimate medicine.
I mean, it really is a remarkably versatile tool. In anesthesia, especially for trauma patients or burn victims, its ability to keep breathing and blood pressure stable is literally a lifesaver. As a painkiller, it can tackle severe pain that just won't respond to other drugs. And of course, there's its most famous new role, giving rapid, sometimes life-changing relief to people with depression that nothing else has touched. On top of that, we're seeing really promising research for things like PTSD, OCD, and even for stopping suicidal thoughts in their tracks.
But, and this is a huge but, now we have to look at the flip side, because with all this power comes some pretty significant risk, especially when it's used in an uncontrolled setting. This is the world of recreational use and the infamous K-hole.
And this is so important to understand. Context is everything. On one hand, you have medical use, a low, controlled dose given in a safe, supervised setting with the goal of healing the brain. On the other hand, you have recreational use, a high, totally unknown dose, often taken in an unpredictable environment, with the goal of inducing a K-hole, an experience that can actually be psychologically traumatic. It's the same molecule, but these are two completely different worlds.
So what does it actually feel like to be in a K-hole? Well, it often starts with that core feeling of dissociation we talked about, but amplified, a complete and total detachment from your physical body.
From there, it often gets really visual. People report powerful hallucinations, sometimes with this recurring theme of flying or being pulled through tunnels or different dimensions.
And maybe the weirdest part? Your perception of time just completely breaks down. A few minutes might feel like hours, or even an eternity. For some, this can feel profound, but for others, it can be absolutely terrifying. Now, beyond the immediate psychological risks, long-term heavy use can have some really severe physical consequences. The most notorious one is something called ketamine-induced ulcerative cystitis. This is a very painful, debilitating inflammation of the bladder that can lead to permanent damage, sometimes so bad that the organ has to be surgically removed.
And unfortunately, the list of dangers doesn't stop there. Chronic misuse is linked to psychological addiction, as well as real problems with memory and attention. It can cause damage to the bile ducts, and for people who might already be vulnerable, it can even trigger a full-blown psychotic episode.
So, where does that leave us? We've got this molecule that's a total paradox, a powerful healer that can also cause profound harm. What's the path forward from here?
Well, there are a few really big things happening right now. For one, scientists are on the hunt for new drugs that can copy that brain-fertilizing effect without all the intense dissociative side effects. At the same time, clinicians are exploring how to best combine ketamine with psychotherapy to help people process their experiences and maximize the healing. And then there's the big societal question. How do we regulate it? How do we make sure patients who need it can get it while protecting against misuse and a boom in commercial exploitation?
And really, that's the bottom line, isn't it? Ketamine is, without a doubt, a powerful tool. It isn't inherently good or evil. Its effect is defined entirely by how it's used. The real challenge for medicine, for science, and for society as a whole is to figure out how we can carefully and respectfully harness its incredible capacity for healing without unleashing its equally potent potential for harm.